Welcome to Let's Talk Value podcast series. And in this season, it's fully dedicated to the publishing of The Next Tango, the book I'm co-editing with Hannah Boetius. However, in this mini series of this spring series, I'm also joined by fellow doctor authors. And today it's my huge pleasure to welcome Dr. Andrea Austin.
It's so great to be here. Thanks for having me on your podcast and show.
So you guys should know, for those who don't happen to know her, Andrea is I should say, lifelong emergency room doctor. So she's really having her finger at the pulse, literally and figuratively. However, she is also a relentless advocate for physician well-being. And she will share with us, there's a couple of good reasons why that is. Not only is she a passionate doctor like I am, but she has really some experiences to share. Also, having worked and working at the Navy as a ER doctor there. She's also the author of Revitalized, her latest book that we're learning about as well today. And she is also a fellow podcast host. So 3 things, Andrea, we share in common, at least.
Yes, and a big desire for change in the healthcare system. And I can't wait to talk about your new book and, where our change making overlaps.
Absolutely. So let's kick it off right away. Our, ingoing question is always, we go from like 50,000 cruise altitude, and then, we go closer to the ground, and like, how can we roll up our sleeves tomorrow and do change? So let's start with the higher level question around, what does value in healthcare actually mean to you, Andrea?
I love this question. And I actually worked in the emergency department yesterday. So I thought about my shift and what does value mean? Health is one of the most important things to any human. I think we're all reminded of this anytime that we're sick. And value is really doing what health, and I love this strategic pause, health care is supposed to do that you talk about in your book. It's supposed to care for patients and support their health. Right now, we have a managing sick system. And, I saw that in full force yesterday during my shift. And while I'm an emergency doctor, I care so much about primary care. And I'm seeing that as we continue to not fund, not support primary care and go upstream, our emergency departments are not going to be able to absorb the aging and complexity of disease without some major changes. So to me, value is expanding lifespan, not just the life expectancy of people. And it's ensuring that we're really promoting their health, not just managing their diseases.
Yeah. And I think we wanted to talk a little bit about our doctor peer group, because obviously, the Next Tango has 2 subtitles. The first subtitle is a patient guide, and maybe we'll get to this in the latter part of our conversation when we maybe take a little bit of a systems view. But I think the second subtitle, all you need to know to deliver great results in healthcare, you and I share this really deep fire passion for our peer group. And we have a dear joined acquaintance that actually brought us together, the dear Cherie Johnson. I hope she listens and sees us, who does a lot in terms of coaching for doctors. So let's pause on that a little bit and discuss, because it's like in the airplane, you can't help your neighbor if you aren't sick yourself. So what happens to the doctors, and what can we do to support our well-being? And really, this is, I know, very close to your heartline. So can you tell us a little bit also what you're sharing in your book in terms of your experience and how your thoughts are?
Yeah, it was really surprising to me the longer I spent in healthcare and I looked around at my colleagues and myself, and what our lack of health really, really means. And, I think about some of my colleagues, they come into a stressful shift, they are cramming some fast food down, they really haven't taken care of themselves. They're just in this fight or flight cycle. And now I'm getting to the age where I'm seeing my colleagues die. I've seen emergency physicians die unexpectedly in their 40s and their 50s. And a lot of us are starting to kind of say, what's really happening here? And how can we be role models for our patients when, we're not investing in our own health? And so I really think we have to go back to the basics and think about our nutrition and are we getting enough sleep? And certainly for emergency physicians, this is challenging with shift work. And somebody has to work the night shifts. But there's so much technology out there. I'm a big advocate of using the Aura Ring or Whoop device, which can provide, this personalized perspective for us to do the special, unique things that we need to do to optimize our health to show up for our patients in a way that's really excellent. And, I think it's so backwards. Like, how did we get so far away from taking care of ourselves and being able to embody what we're asking our patients to do? And so obviously the system needs to be built around patients, but to forget about the people taking care of these patients is really short-sighted. And I'm glad more organizations are starting to recognize that.
Thanks, Andrea. And I want to cite Cherie, as we brought it in the preface to our book, The Next Tango. We quote her, "Stop surviving and start flourishing," in her book, The Thriving Doctor. And there's a nice figure actually that we were able to take from her book with the acronym HALTS, and saying every doctor on a busy ward has experienced at least one of those feelings, and some of which, Andrea, you just mentioned. HALTS stand for hungry, angry, lonely, late, tired, stressed, and becoming sick. And now you're added a D, is like dead at the end of the street. So we're a little bit provocative here, but I think the numbers speak for itself, that burnout is increasing, and long-term actually disability due to depression. So I think all of this is, we don't want to become too negative on this podcast, because it's a podcast of, what can everybody do? And that is a nice segue, because I love one of your chapters, Andrea. It's about the music. And we had just on the podium another of our fellow doctors, Dr. Steve Klasko, who is also a DJ, and he published a book, Feeling All Right, and how the music can make healthcare healthier again. So can you tell us your practice that you do before you go to a shift as it relates to music, Andrea?
Yes. Well, I'm really excited that I'm the Chief Wellbeing Officer for Chief Wellness Officer for Feminium. And so some listeners may be familiar with Feminium. It started a few years ago, went quiet, and now has come back as a nonprofit supporting reproductive health care for patients and healthcare worker well-being for those working in the emergency department. And they had a beautiful conference, and one of the talks there was by Joanne Bohart, and she shared this practice of developing a walk-up song. I just then created a walk-up playlist. So, we all have days when we're going into a shift, especially given how frenetic American healthcare system is now. So to have that playlist of songs that I can get ready for my shift is really great.
And I really invite people to look at your book. And I looked at it as I was reading it again over the weekend. like obviously we at 5P Healthcare Solutions go by the 5Ps: patient, provider, pharma, payer, policy. And what I did see in your book is the 5R. So I really think it's great in your chapters. At the end, you have the reflect, reimagine, respond resources for readers actually to take notes and immediately reflect on your chapter and make notes. And I think this is what both you and I and our colleagues want to foster, is like, how do we move our observation of understanding, getting ideas into my own actions? And I really want to recommend everybody, follows that, what you're suggesting. And so in the Next Tango, we have a similar thing. At the end of the 5 chapters, we have a checklist for everybody with questions directly to the reader. Hey, here's what you can maybe think of doing. And that's maybe the segue to talking a little bit about the system. And I want to do that also with a couple of quotes from your book. I mean, first of all, the nice one: doctors are human too. But you also say we really need a comprehensive overhaul of the medical culture and a no blame culture. And that's the segue to what we stand for also with 5P Healthcare Solution, is a transformation towards value-based healthcare, where we shift the focus not to pay for services from a system perspective, but we would pay collectively for the outcomes achieved for the patient. So hip replacement, the outcome would be, well, the patient can walk again. And then both the surgeon and the anesthesiologist and the hospital bed would be reimbursed, and the payer and the patient, everybody collectively works towards those outcomes. What it does nicely in instances where this is already happening, it's not only a theory in a book. I wanted to quote actually the Martini Clinic in Germany, the specialized hospital for prostate cancer patients. And they, over 15, 20 years of relentlessly focusing on the outcomes that matter to patients, not only the survival from cancer, but also the functioning that we can see that can happen, in terms of side effects. And what it does, it catalyzes the teamwork and the care coordination. And now I'm spanning the cycle back, Andrea, to it fosters the no blame culture of the doctors, because the problem is we don't want to be accused, oh, we missed a margin in resecting that tumor. And then the doctor is in the press and in the media, and it's like, this is a bad doctor. So I'm bringing it back, and I want to hear your experience. Like, what can everybody do to nurture that new culture where we act and think as a team, and we don't blame each other for when something has gone wrong? Any thoughts from your perspective and experience?
Yeah, I mean, this is still very counterculture. And I think the more that certainly the people listening to this podcast, your actions matter and your words matter. So when you role model this, when you're vulnerable and say, I'm having a hard time with this case and I'm going to need the team to provide some input, or we're going to need to pull in, a resource to meet this challenge. That, I do this regularly, and my initial reaction is, I need to figure this out on my own, because that's how we were trained in medicine. That, we were taught, I'm not saying I agree with this, you're at the top of this hierarchy, you are captain of this ship. And at the end of the day, whatever ends up happening here is your responsibility, and often was, your fault, was the language used. And so it takes the inner work. And I think this is where, pulling in all the wonderful things that Cherie has done, and really what my research on change makers in healthcare is showing. We all want the system to change, but the truth is the system doesn't change without us individually changing. And so when you say, I want a culture of healthcare in which physicians can be vulnerable and say when they need help, are you doing that yourself?
And I think the link to the value-based healthcare transformation is in our latest publication that we internally call the hot dog paper, but there's actually a field survey of 12 organizations that have successfully done value-based healthcare transformation. And in the latest podcast with Dr. Steve Klasko, whom I already mentioned in the context of music, he's the former CEO of Jefferson Health, who has transformed his organization. So obviously you need the top-down support by the organization, because that's what maybe many of our fellow doctors now say, well, I can do it, but if my boss continues hammer on me, I will burn out. So yes, you need both. You need a new, leadership team in your health organization that supports that change, and that we all measure and look at what's best for the patient, because that is then galvanizing that coordination with the doctor, the nurses, the social worker, etc. But then I think it's also up to us as doctors individually at the forefront of the healthcare delivery to take actions ourselves. And there are plenty of resources like your book, like Cherie's book, like coaching programs that we deliver, that you deliver, Cherie delivers, and many others. So I think it is this usual in life. It's the pull and push. So yes, you need support, but it's not only, you can't say only the others need to fix it. So I like your call for action as well.
Yeah. And I'd also challenge listeners to check some of their assumptions. A very common thing that, we say in physician culture is, well, it's the administrators. If they got out of our way, then we would be okay. And Dr. Wendy Dean has done some great work showing that healthcare administrators also experience moral injury. And I had a meeting with my healthcare system CEO, and what she shared during that meeting was that she really got it. And coming back to the 5 Ps, a lot of her pain points and why she wasn't able to move the needle on some problems as fast as she wanted came down to policy. And once I began to humanize her and her response to some of the challenge in our system, it didn't take anything away. It didn't fix the boarding crisis in our emergency department, but it gave me a lot more perspective. And then when other people started to complain in my department, I could provide a little bit more context and say, listen, if this is something that it matters to you, here's some different avenues of how you could use your voice, your agency to make change, but it's not going to be as quick as any of us want it to be.
I think this is amazing. The humanizing, even the administrator, shocking.
Yeah.
This is what we do a lot in our negotiation work with the 5 Ps. And thanks for mentioning bringing in policy, so important. But at the end, we don't discuss with the FDA. We don't discuss with NHS. We discuss with Paul at the FDA and with Susie at the NHS and Helen in the administration. And they also have their personal perspectives. I like that, challenging our assumptions. That's a really good way to start closing the podcast. This is always the terrible moment when we look at time and we have those conversations. Andrea, any last concluding remarks as we have spoken about revitalized and the next tango?
Well, I just want to thank you for what you're doing with the next tango. A closing thought would be, a lot of times, especially for clinicians, maybe in a fast-paced field like emergency medicine, we want quick solutions. When a person comes in with a shoulder dislocation, I love getting it back in the joint, and sometimes under 3 minutes. But the problems we're talking about today are dilemmas. That was a huge growth thing for me. And dilemmas don't have easy solutions like some problems. Your framework of the 5 Ps, and I love that you're pulling in the patients and really bringing them to the center of this and using design thinking to, how can we reimagine our system. And so I thank you. And I also want to highlight somebody, Kim Downey, has a wonderful platform out there in which she's Stand Up for Doctors. And she's really trying to close the gap between patients and doctors, because I truly believe once we get patients and providers on the same page, these changes are going to happen.
Lovely. Amazing. I'm going to share just 2 quotes. Value-based healthcare holds the power to break down silos along the patient journey. It pulls together all actors, 5P, needed to deliver best possible results that matter to patients. And it brings everyone onto the same page. Written by a patient, my co-editor, Hannah Boetius, in chapter 1. And then the very last one in chapter 4 with the pairs is like value creation So we bring it back to the first question. Value creation in healthcare is actually negotiation on a humanistic level. Thank you so much, Andrea Austin.
Thank you, Dr. Voelter.